Hi, my name's David Ayres from Core Physiotherapy and Pilates Studio. Today we're talking about a topic that affects 80% of us at some stage during our life, low back pain. Let's start by looking at the anatomy of the lower back. As you can see from our model here, the low back is made up of several different structures. The main ones though that we can see are the vertebral body, which is this large bony structure here, the intervertebral disc, which connects those vertebral bodies, so this small little structure between them here, the spinal cord, which runs through a canal through the back and obviously provides the supply to our nerves that run into our arms and legs and the rest of our body. It's also got ligaments that connect these vertebrae together, and then what we can't see here that wraps around here like a sling is our core muscles. Okay, so low back injuries can occur to any one of these structures, but what we're going to focus on today is injuries to the disc. So sitting is one of the main issues that people with disc injuries tend to present with. So we can see normally the spine, if we get Olivia to sit up straight for us there, normally the spine has a little curve through the lower back here. If we spend any time where we're sitting in positions where we lose that curve, so if we get Olivia to slouch out of that posture there, then that puts excessive strain on the discs through our lower back. And if that strain is put on for any prolonged periods of time or of a high degree, then that can certainly cause some damage to the discs. So we certainly want to watch that with our clients, that we're maintaining and that they have a curvature in their lower back when we first see them. So the second factor that we want to talk about is excessive forward bending of the spine. So we can see again with Olivia, if we get her to bend forwards as if she's going to pick something up off the ground. So again, it puts a high bend in her spine here, which puts again a lot of pressure on those discs in the lower back. So we'll get you to straighten up again there now. Yep. So that's the second one that we want to look at. So if we were to couple that in with bending and lifting, then that puts even more pressure again on those discs. So looking at bending and lifting postures is really important towards protecting these sorts of injuries down the track. When someone presents to our clinic with low back pain, we start with a step-by-step process to identify the source of that pain. We base a lot of our assessment on the McKenzie method, which is a mechanical method for assessing low back disc injuries in particular. So we begin that process with an interview where we talk about how their pain started, how long it's been happening for, where their symptoms are. We also talk about what aggravates their pain, what eases their pain. So we find those easing symptoms are quite good clues in particular for us to start to develop strategies to help manage their pain in the short term. So some of the areas that we commonly see people with low back pain from a disc are, if we come back to Olivia again here, pain in the centre of their low back, pain that comes across their low back, pain on just one side or the other, pain that switches side, pain that runs down their leg, which people often call sciatica. If you do have other symptoms though, things like pins and needles, numbness, weakness in your leg, then it's really important that we get you to see your doctor or a physio urgently to get those symptoms assessed appropriately. Yep. Okay. So after we've been through and we've identified the area of their pain, what's aggravating and easing it, then we go into a more mechanical assessment of their movements. So one of the things that we look at very commonly with people with disc injuries is how well they extend their back. So we're just going to get Olivia to put her hands on her back and just getting her to arch her back backwards. So we might get her to repeat that movement. So if we get you just to put your hands on your back again and then just arching back again and then coming back up and then again. So what we're looking for here is whether the pain changes, whether her movement improves as she's doing that, whether the pain changes location or intensity. And again, it's just giving us clues as to what might be the right strategies to help her with her low back pain. So then we go to palpation. So with palpation, what we're looking at is the quality of movement through the joints, and obviously where the pain is actually coming from. So we can get a good feel through just by pressing gently down through here to start with. And once we've identified an area where the back is feeling particularly stiff, or it's eliciting the pain that she has been experiencing, then we'd be looking at seeing whether by mobilising that area it helps to relieve that pain. So once we've completed the assessment, we've then got a good idea on the level of the injury, the direction of treatment, and the likelihood of it responding to that treatment. So our initial management of disc injuries involves focusing on reducing the disc injury, obviously, and we do that through education on what the disc injury involves, posture correction, preventative and corrective exercises, and hands-on treatment. So what we quite often tell our clients as a protective thing when they do injure a disc is to avoid things like sitting for long periods, bending and lifting obviously, and we also quite often get them to start doing some gentle exercises to help to reduce the pressure. So we're going to demonstrate one of those exercises here, and that's the elbow prop. So with Olivia here now, we're going to get her just to pop her hands under her forehead, keeping relaxed through her back, and then we're just going to get her to slide her elbows under her shoulders, keeping her hands where they are, coming up into that elbow prop position, and then sliding the elbows back down. So the aim here is just to get some extension through her lower back, which can potentially help to reduce the pressure on her discs, and we're going to get her to repeat that movement. So repeating that again there, Olivia, and then sliding back down. Okay, so what we're looking for when we're doing this exercise is, does this exercise reduce the pain in her lower back or allow her to move or extend her spine better? Does it relieve some of the symptoms that she may be getting in her leg? And what we really want to be cautious of is that we're not increasing their symptoms, okay? So once we've got the acute pain under control, we then want to start to focus on restoring movement through our back. So in those early stages, there's been a lot of guarding and protecting through our muscles, and those are going to start to become quite stiff and rigid and can quite often cause us some of the longer term problems that people experience with low back pain. So one of the exercises that we're going to look at is doing some rotation through our back, which starts to get some of those muscles stretching. So it's quite a nice simple exercise, again still respecting that the disc is still healing. We're just going to get her to bend her knee up and then bring her knee across to the side. So you can see how it just gently stretches through the lower back and hip area, which, like I say, are those areas that were quite tight in those early stages. Okay, so we'd get her to hold that stretch for 15 to 20 seconds. Okay, and then we'd probably do that on the other side as well. So bringing up the other leg and then coming across the other way. Once we've started to get movement back, the other important thing for us to look at with our clients that have low back injuries, particularly if they are significant, is to retrain their core muscles. So if you're looking at getting into that phase of rehabilitation, we recommend that you look at our other videos.